Acquired immunodeficiency syndrome, also known as AIDS. AIDS is the final stage of human immunodeficiency virus, also known as HIV. HIV takes over white blood cells and annihilates the immune system. One of the types of cells it kills are called CD4 cells. CD4 cells are vital to the immune system and to keeping someone healthy. HIV is also known as a lentivirus because it is slow acting and slowly destroys everything. Scientists are not 100% sure where AIDS and HIV came from. They think it's a form of simian immunodeficiency virus, also known as SIV, which is basically AIDS for primates, like chimpanzees and gorillas. In the late 1800s, people in Africa were hunting these animals for food, and it transferred from the animals to humans. Between 1924 and 1972, the virus evolved and traveled from Africa to Haiti to America. It spread in America for about 10 years before the first reported cases in 1981. In the summer of 1981, the Center for Disease Control and Prevention started getting reports from California and New York of a rare type of pneumonia and Kaposi's sarcoma, which is a rare form of cancer. At the time, the only people who were affected were homosexual men, so they called the disease gay-related immune deficiency. 1 year later, in 1982, scientists discovered that it was blood and not homosexual activity that spread the disease, so they renamed it AIDS. In 1983, French scientist Luc Montagnier discovered HIV, and his claim was confirmed by American scientist Robert Gallo. In 1985, the first approved HIV test came out. In 1987, the first FDA-approved drugs for HIV came out. At this point in time, it had become a worldwide epidemic. The thing about HIV and AIDS is a person could get HIV and then immediately get AIDS, or the person could get HIV and not get AIDS for up to 12 years later. During all that time, they might never know that they have HIV. They don't feel sick, so they don't feel the need to go get it tested. AIDS is when the immune system has broken down so much that opportunistic infections can get in and just invade the body. This includes those rare forms of pneumonia and cancers. In 2013, the United Nations report on AIDS said that there are about 35.3 million people living with HIV. 2.3 million people were newly infected, and in 2012, 1.6 million people died from AIDS. 36 million people worldwide have died from AIDS since 1981. Anybody can be infected with HIV and get AIDS. HIV can be transmitted through sex, blood, or from mother to child. It is spread through infected body fluids such as blood, semen, vaginal secretions, and breast milk. If those infected body fluids get into the bloodstream of a non-infected person, they will be infected with HIV. Casual contact like hugging, kissing, drinking fountains, and mosquitoes does not put someone at risk for getting HIV. It can be 100% preventive if you never have sex and you never do injection-type drugs. If you do those things, you can protect yourself by having safe sex and never sharing needles. As of right now, there is no cure for HIV and AIDS, but there are treatments that keep patients alive. Highly active antiretroviral therapy is one of those treatments, but if the treatment stops for any period of time, HIV can flame up again. There are researchers out there who are diligently trying to find a cure to AIDS. There's a link in the description below that leads to a PDF of all the AIDS research that happened this summer, so you can check that out and just learn about what happened. Awareness not only helps those who are not infected protect themselves, it helps those who are infected with HIV. There are links in the description where you can do further reading on AIDS and HIV research, and where you can donate to AIDS research. I will see you guys in my next video, so see you later.